Patrik Hutzel from intensivecareathome.com, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomies, and where we also provide tailor-made solutions for hospitals and intensive care units, whilst providing quality services for long-term ventilated adults and children with tracheostomies, and also otherwise medically complex adults and children at home, including home BIPAP, home CPAP, home tracheostomy care when adults and children are not ventilated, and also we provide home TPN services. We also provide home IV potassium, home IV magnesium infusions, as well as IV antibiotic infusions at home. We also provide port management, central line management, PICC line management, Hickman's line management, as well as palliative care services at home, including ventilation weaning at home. We are also providing emergency bypass services where we send our critical care nurses into the home to bypass ED, emergency department presentations, and we have done so successfully in the past for the Western Sydney local area health district in touch, and we've prevented many emergency department admissions as well. So today I want to talk about a recent case study, or a current case study, where we have taken someone home from hospital who has been in hospital for 6 months out of every year for the last 5 years because of TPN. TPN is total parenteral nutrition. And with TPN, patients either have a central line, a PICC line, a Hickman's line, or a port, which is the skill of a critical care nurse to manage that port and the TPN connection and disconnection. And that was one of the reasons why this particular client has been in hospital for so long. And finally, we managed to take her home with our critical care nurses so that she can stay at home and have TPN at home rather than more or less living in hospital, because that's what this particular client unfortunately did. What is needed for that? What is needed is a script for TPN from a doctor, of course. What is needed is ongoing, pathology, so that electrolytes can be monitored. A dietitian is involved, of course. A dietitian is needed. Gastroenterologist who's prescribing the TPN, and obviously then there's a team of critical care nurses needed who can facilitate the connect and the disconnect, because I know there are many people in hospitals, stuck in hospitals with TPN, that can go home. And it's important that you get this message. It's important that you know that services are available for you. And I don't want to, make this video too long today, but it's really important that you know what we do for our clients and how quickly we can help you. This client went home from inquiry to us probably within a couple of weeks. She was finally at home, and now she's been at home predictably. I guess that's another important thing. You want to stay home predictably, whether it's for ventilation, tracheostomy, BiPAP, CPAP ventilation, tracheostomy without ventilation, whether it's like the TPN. You want to stay home predictably, and you can do so with critical care nurses, with intensive care at home. We put our money where our mouth is, So and you might be watching this, and you have TPN needs, or you have a tracheostomy, or your family member has TPN needs, but is stuck in hospital. I encourage you to reach out to us, so we can help you take the next steps to go home. Now, with intensive care at home, we are currently operating all around Australia. We are in all major capital cities, as well as in regional and rural areas. We are an NDIS approved service provider all around Australia. We are a TAC approved service provider and WorkSafe approved service provider in Victoria, iCare in New South Wales, NIISQ in Queensland, as well as the DVA, a DVA approved service provider all around Australia. We have also received funding through public hospitals, departments of health, as well as private health funds. So reach out to us if you need help for any of the things that I just mentioned: ventilation, tracheostomy, BiPAP, CPAP ventilation without tracheostomy, tracheostomy care without ventilation, home TPN, home IV potassium infusion, home IV magnesium infusion, palliative care, as well as ventilation weaning at home. And like I said, we also provide critical care nurses into the home to provide an emergency department bypass service, because you might be watching this and you work in ED, you might be a hospital executive, you know that your ED is overflowing, you know that your ICU is overflowing, and we can help you with that. We also provide level 2 and level 3 NDIS support coordination if you need help with an NDIS support coordinator and NDIS intake. Also, our NDIS coordinator will help you with upgrading your funding, with negotiating with the NDIS or with any other funding bodies. You know that the advocacy that we do doesn't stop just at the NDIS. We also advocate for our other clients, whether it's the TAC, iCare, NIISQ, DBA, private health funds, public hospitals, departments of health. You know, you should reach out to us. That's how we got started way before the NDIS was even a thing. We just advocated for our clients, and we got funding through other funding bodies too. Now, and part of what we do is we also do specialist NDIS nursing assessments for our clients. Now, if you are an NDIS support coordinator watching this, and you're looking for nursing care for your participants, and you can resonate with what I'm saying here, and some of your participants probably don't have the level of care they need, and you need more funding, and you don't know how to advocate for nursing care, if you need an NDIS specialist nursing assessment, we can help you with all of that. We've been there, we've done that. We can help you with all of that. And you can also talk to our NDIS support coordinator, Amanda. We're very happy to collaborate with you. It's all about creating win-win situations. And if you are a critical care nurse and you're looking for a career change, we also want to hear from you. If you have worked in critical care for a minimum of 2 years, ideally ICU, pediatric ICU, or ED, and you ideally have completed a postgraduate critical care qualification, we want to hear from you. We currently have work in Melbourne, Sydney, Brisbane, South Queensland, in Victoria, in Bendigo, as well as in the Warragul area. We want to hear from you. We are looking for critical care nurses that want to work with us regularly. We are not an agency where people come and go. We are a service provider that has a tailor-made solution for our clients and their families, and that tailor-made solution includes regular staff who want to do regular shifts, so that they can get to know our clients, because the clients want to get to know our staff. And if you are an intensive care specialist or an ICU consultant, we're currently also expanding our medical team. We want to hear from you as well. And if you are an intensive care specialist or an ICU consultant and you have bed blocks in your ICU, I also encourage you to reach out to us. We can help you eliminate your bed blocks in ICU and pediatric ICU. But more importantly, we improve the quality of life, and in some instances, quality of end of life for some of your patients, and you won't even pay for it. And if you're a hospital executive watching this, we also want to hear from you, because once again, we help you eliminate bed blocks in ICU, pediatric ICU, respiratory wards, and ED. And if you're watching this and you're in the US or in the UK and you need help, please reach out to us. We can help you there privately. Once again, our website is intensivecareathome.com. Call us on one of the numbers on the top of our website, or send us an email to info@intensivecareathome.com. Also, if you like my videos, subscribe to my YouTube channel for regular updates for intensive care at home, but also for families in intensive care. Click the like button, click the notification bell, comment below what you want to see next, what questions and insights you have from these videos. Share the video with your friends and families. I also do a weekly YouTube live where I answer your questions live on a show, and you get notification for the YouTube live if you are a subscriber to my YouTube channel, or if you are a subscriber to our email newsletter at intensivecareathome.com. Thank you so much for watching. This is Patrik Hutzel from intensivecareathome.com, and I will talk to you in a few days. Take care for now.